This is a special edition of Late Night Health. I'm Mark Alyn. Our guest is somebody that is, to me, he's a national hero. I'll tell you why in a moment. His name is Dr. Garth N. Graham. He's a medical doctor. He has a master's in public health. He's a cardiologist. He's an expert in minority health, and he is currently the Vice President of Community Health and Chief Community Health Officer at CVS Health. And Dr. Graham, welcome to Late Night Health. Thank you for all you've done in making America healthy, being involved in the construction and architecture of the Affordable Care Act.
Thanks, Mark, for having me.
Oh, my pleasure. Anytime. You're welcome back. We have a health crisis, a pandemic worldwide.
Yeah.
How are Americans in general and doctors handling COVID-19, in your opinion?
Yeah, it's a challenge. I think, the healthcare system and communities, both locally and globally, this is unlike anything we've seen in recent history. And I think we're rising to the challenge. I think, it's important to realize a lot of this is going to be the challenge that we face, for a little while longer going into the fall, and if not beyond, et cetera. So I think we are all kind of stepping up to the game from, honestly, this is such a global issue. It's not even just medical and community health. It's really just, people from all sectors of life right now really kind of coming together to deal with this challenge. I'm
curious about families, okay? So I want to take your family. Do you have children? And how are they reacting to this? No school. Yeah. They can't see their friends. This is not fair for kids.
You sound like my kids when you just said, no, this isn't fair. The thing is, there's a lot of hard choices we all are making to keep our families and keep our communities healthy. The social distancing that we've had to do, and many of us, including myself, in not being able to interact with our parents and grandparents as often as we would like. Certainly, these things are challenges, these are sacrifices, but they're necessary sacrifices, and that's the thing we I think are all understanding, is that these are the things we need to do to kind of turn things around. So it certainly, I think, globally does not feel comfortable. But one of the things we do know, quite frankly, is that these things work. And social distancing, wearing our masks, washing our hands, staying home if sick, these are the ingredients to kind of make our way out of this pandemic as a global community.
And at the same time, we have other health concerns. You get a bee sting and you think you might be allergic because you're outside, at least in your backyard. You might be gardening, get stung by a bee. You could fall, all these things. But people are afraid to go to the doctors because the person next to them in a waiting room, they could have COVID-19. What do we do?
Yeah, so these are major challenges. Not only just bee stings, but people may be having chest pain at home, and they have a heart attack or slurred speech, and it's a stroke. Or they may not be doing the preventative care that they need to actually make themselves healthier. So it's important for people to understand that these acute and chronic medical illnesses are very serious, and that they should seek timely care. You could die from a heart attack at home. You could die from a stroke at home. Cancers that are not screened for appropriately could impact you in terms of mortality and morbidity. So knowing the importance of these diseases is one thing. The other thing to know is that many hospitals and doctors are doing things to make your visit there safe. So if you have an emergency, you should go. I'm very categorical about that, because people need to understand the impact that these decisions may have on their immediate life, and so it's important for people to seek care when they need it, especially the urgent care that's appropriate, and to understand that doctors, hospitals, the whole healthcare system have been doing a lot of work to make sure that things are safe for you to appropriately, in many times, seek life-saving care.
CVS has urgent care. They have the 1-minute clinic in many of their locations. Are urgent care facilities up to snuff? I know this because my wife has been told to go in and take a blood test, and they said go to urgent care to do it.
Well, here's what I say to my patients and my family and my friends. Call ahead to the places you're going to go to, and you certainly can ask questions to make sure you at least feel comfortable. Now, we know that we've been implementing a lot of safety protocols, certainly on the CVS Health side in our mini clinics, and we see that replicated, like I said, across the healthcare system. So I think the confidence that I have in the healthcare system to kind of keep things safe is high, and certainly as a clinician, I feel as if recommending to my patients that they should seek as appropriate. But I want my patients, your family members, mine, to feel that level of comfort as well. So calling and having these conversations and asking questions to make sure you're reassured, I think is also part of dispelling the fear and concern that we as a community may have.
You mentioned that we're entering, getting ready for the fall and winter, which is a high flu time. Would you recommend flu vaccines at this time, that people should start considering to get them? Because, flu season is just around the corner, and there are alternatives to that too, a lot of supplementation. We've talked about that here on Late Night Health. But, I'm just getting used to the fact that it's 85 degrees here in Southern California. With no humidity, you people in Atlanta and where you are, Doctor.
Yes.
Should they do that?
I'm just envious of that weather. Let me just start off by saying that. But I always encourage people to get their flu vaccines. The flu vaccine has been shown to decrease mortality, especially for people with chronic illnesses like heart disease, and independent of COVID-19 is important. But now with COVID-19, it's important to get that extra protection against the flu. And to think about that. So when the flu vaccine kind of fully comes on board towards the fall, I would certainly encourage you and my own family members and my own patients, as well as your other listeners, to get the vaccine.
Doctor, the other thing that's happened to me, unfortunately, is that I haven't exercised. My gym was closed. It's opened again, but I'm not going back in. I just can't do it. I've been trying to walk. I've been doing light weights. And yet, the battle of the bulge, the Mark Alyn tummy, is getting bigger. Exercise still important?
Oh, exercise is vitally important. That's another thing that we've seen fall in this pandemic is the amount of physical activity that people have. And here's what I say again to family, friends, patients. I say to your listeners is, get outside and exercise. Don't forget, it's at least half an hour, 5 times a week is still the recommendations. And if you can safely get outside and social distancing, do that. Because those are the kinds of things, that's the kind of down payment in terms of your long-term, short and long-term health that you need to invest in. But rest assured that it's not just you. I think as a country, we kind of fell off the wagon a little bit when it came to kind of physical activity and exercising, a lot of that because, having to stay indoors. But now as we're able to get outside in the weather, we just need to safely do the kinds of exercise and things that keep your heart and the rest of your body healthy.
And weights are important even with people who are maybe a little bit older as well. I know we're cramped for time, so I just wanted to say thank you. Dr. Garth N. Graham, he is Vice President of Community Health and Chief Community Health Officer for CVS Health, and we appreciate his work in the past, and we look forward to him doing more work in the future at CVS. Thank you very much, Doctor. I'm Mark Alyn. This is Late Night Health.